Good afternoon, everyone. Today we will discuss about the therapeutic management of the bovine papillomatosis, which is one of the very common field conditions. And we will also discuss about the pharmacological management, the reasons behind it, the virus which is responsible for this particular disorder, and also many more things which are related for the treatment and prevention of the particular disorders. So coming to the first one, especially the bovine papillomatosis or warts, which is also called as the layman's terminology, includes the disease of economic and veterinary importance, which is leading to the significant economic loss to the livestock in terms of leather depreciation, because the lesions are going to have the especially depreciation values of the leather, just like what is looking like this. And mortality when progress into a neoplasm. Many times, if the papillomatosis is untreated, it also goes to the extent of the death also. And animals such as the horse, cattle, birds, and wild animals such as tapir, giraffe, antelope, and zebras. All these are affected by bovine papillomatosis. Means no animal is exempted except certain very thick-skinned animals. This is going to affect almost all the animals. So the curve here you can see that one of the curve which is suffering from severe cutaneous warts or papillomatosis of varying sizes and also in case of the shapes. And we can find many such type of the cattle which are suffering from such disorder, dermatological disorders. So we need to take care of all these things. And apart from this one, the bovine papilloma virus, as such, it's caused by the Papillomaviridae family and genus Papillomavirus. So they are the DNA type of the virus infecting the epithelium of the animals and also the mucosa of humans. Many times it's also going to affect the mucous membranes of the human beings, and of course warts is also a common disorder in human beings. Hence, we can see that this is a disease of causing the humans and also the animals. Of course, it is not zoonotic, and they are very strictly species specific and site specific viruses. So, a virus which is affecting one type of the species will not affect the other type of the species and cause the benign proliferative growth and do not infect any other host than that of the natural host, just like what we are seeing in this particular this table is considering. See, the reason is considering. Then, apart from this one, the only known cause of the bovine papilloma virus is it's the BPV1 and BPV2. Of course, there are varieties of the virus are there, but it is only restricted to only few of the virus. And there are more than 14 pathotypes of the BPV, which are affecting the horse, sheep, goat, cattle, and also the human beings. And these prototypes are grouped into four subtypes like the BPV 3, 4, 6, 9, 10, 11, 12, etc. Then also the Delta papilloma virus like BPV 1, 2, 13, 14, which is also called as the fibropapilloma virus, and epsilon, also called as the BPV5 and 8, and deoxypapilloma virus, it is BPV7. Whereas the equine sarcoids are caused by type 1 and type 2 here, because many times it is going to be a benign tumor, and the BPV virion is non-enveloped and it's about 55 to 60 nanometer in diameter, containing the double stranded DNA approximately with 8,000 nucleotides. So this DNA virus is having the 50 to 60 nanometer in diameter, and six type of the BPV have been characterized, of which the BPV1 cause the frond fibrobapilloma of udder and teat. So this is the prime virus, bovine papilloma virus and 2. So this is the diversity of the bovine papillomavirus present in the samples of a particular study conducted in the presence of the complete and partial length more than uh, 350 BP. So here the gene sequencing has been done and the number of samples have been collected, and also it is later classified as frequency of different BPV types in the samples of the study. Like here you can see that the incidences of the different type of the bovine papilloma virus, especially from the 16 type of the samples like BP3, BPV4, 8, 9, 27, and these are named as the BPV39, where most frequent types of the found in that of the study here. So varieties of the virus which are causing with the BPV39, which is 6%, it is causing, and hence of course BPV27 also, and BPV9 and 8. So all of these are going to cause the infection, even though BPV1 is a very common thing. And the PCR expression of the L1 gene in agarose gel electrophoresis is looking like this. And usually the varieties of the virus are also isolated from the bovine rumen, whereas the X phytic lesions from the filiform, and another one is the nodular type of thing. And Usman et al. Very recently they have reported this type of the lesions from the bovine rumen also. Means they are not only located to the skin but also sometimes they are also going to affect the internal organs. Hence, the transmission of this virus is direct contact with the contaminated objects, especially anthropoid vectors, and vertical transmission has also been reported as possible modes of the transmission. And blood transfusion can also transmit the bovine papilloma virus 1, and that's vertical transmission, especially to the cows. And cofactors such as most of the time malnutrition, the hormonal imbalance, the mutations, and long-term exposure to sunlight could shoot up the risk of the bovine papilloma virus infection by causing the immunodeficiency on this type of the teats. Teat is one of the most important location of this particular virus, and accordingly, these are all the other subclasses or subcauses apart from that of the virus, like the deficiency of nutrients, maybe the macro, zinc, and the deficiency of different type of the hormones. And long-term exposure to sunlight is also another cause of the bovine papilloma virus. So the papillomas or warts are the finger-like projections. So everywhere you can see on the mouth of the animal, and also loin, then udder, are everywhere, and may be isolated or multiple or originate from the skin surface of the teeth also. Very commonly it is located in teeth. So usually the warts do not interfere with milking unless if they are ulcerated or cracked, or it may be cause some time of the pain, or else it is having the non-disturbing type of the nature. But the bovine papilloma virus (BPV) is a group of DNA virus. Usually, they are going to affect the teats many of the time. But the BPV 5, 7, 8, etc., they cause rice grain papilloma of the udder, and BPV 6 causes the frond epithelial papilloma of the bovine udder and teat. In older cattle, papillomas are usually confined to the udder and teat, and the spread between the animals is thought to the teat cup liners and also the milkers, because the transmission is always it is by the milking and from one cow to the another cow. So there is a wealth of anecdotal evidence that the areas close to low-lying river, plains, and forests are more prone to warts, as per the report of Armstrong, that's the in the year 2007. Then the incidence wise, the advanced stage of the lactation, usually it is the most suitable stage of the papillomas, the occurrence of these papillomas. So these are the going to cause the maximum lesions that will be observed. So number one, highest incidence is in the winter season, then also followed by the autumn season, then summer it is about 20%, and also in the spring it is 8.89%, that is lowest. Means in the winter it is highest. The reason for fewer lesions during the summer and spring may be the better skin condition, especially during these months with the warm weather also. So the incidence is somehow less. The coming to the teeth, where in which we can find highest number of the warts is the first teeth is affected in 68.89% of the animal, whereas all four teeth are affected in 17.78% of the animal, whereas only two teeth like this are affected in about 11%, and all the three teeth will not be affected. It's very rare, 2.2%, whereas the concurrent on the other and other part of the body tissues is also so to the extent of 6.67%. So the incidence of the warts is usually higher in females, especially the lactating animals, other than that of the males. So the bullocks and other animals do not have much incidence of the uh, virus, and younger animals were affected more when compared to the adults. Then the wart lesions were found to be more in teats and neck. These are the important regions where the highest lesions have been seen as per the Kumar et al. 2020. Whereas the scant information is available on the papillomatosis, especially in case of buffaloes, and it's an almost unknown disease in there, but we cannot say that it is not present. But few of the persons like Somoshi in the year 2021, they reported that the buffalo papillomatosis occurs in cutaneous and also the mucosal form, whereas the cutaneous papillomatosis is manifested as cutaneous wart and teat papilloma type of the virus, whereas the condition is known to be caused by the bovine papilloma virus 1 and 2, or sometimes the mixed infection, especially in case of the buffaloes. Whereas the pathogenesis, how it is going to cause the viremia and also the disease or the projectile nature of these lesions. The virus usually infects basal keratinocytes, leading to viral genome replication in the species and the granular skin layers. So, usually what happens is initially the upper layer is affected, followed by the below layers, and expression of the late structural proteins of the virus is limited to the differential cells of the squamous layer. The new virus particles are capsulated and shed into the environmental, and the particular cells, they are going to die. So this is the normal versus the connective tissue cases. Whereas the neoplasia may also happen whenever the epithelial connective tissue and can be a papilloma or a fibrillopapilloma. So this is the way how the virus is going to affect. Sometimes superficial, then it goes to the deep, and later it's going to produce some of the unwanted structures where the quantity of the virus is very high. So here the dense irregular connective tissue is one of the habitats of this virus, whereas the Delta papilloma virus leads to an initial transformation of the subepithelial fibroblasts, followed by the plexiform acanthosis, and then the papillomatosis. Then also the C papilloma viruses include epithelium virus and without the fibroblast involvement. Whereas the benign papillomas sometimes transform to malignant squamous cell carcinomas also. Initially, they will be benign, then they are going to turn into the carcinomas. And whereas the bovine papilloma virus 2 can in fact, transitional epithelium of the bladder also, urinary bladder, and the chronic epithelium of chorionic epithelium of the placenta also. Some of the reports also documented this particular very special type of the location of this particular virus, especially the bladder and placenta. So coming to the histopathology, if you cut off on the particular wart tissue, etc., then the histopathologic presentations will be like the acanthosis, the black dual head row. This one is the one, whereas it is also called as the hyperkeratosis. Then the followed by white dual head row. It's also called as the stratum, whereas stratum spinosum layer thickening, and the particularly the superficial tissues are going to be decayed later and necrosis happens, and the new type of the tissues is going to be developed. So whereas here you can see there's different stages of the infection of the skin, followed by the invasion of the fibropapilloma. Here, the fibrous tissue inflation, this inflation is there, whereas the proliferated cells of the submucosa show the moderate pleomorphism. Here also you can see it. There is a moderate pleomorphism. Whereas the squamous papilloma sometimes is also going to be termed as the cancerous tissue. Whereas the keratinocytes of the skin, they show the increase in the keratino hyaline granules like this, the hyaline granules, it can be seen. So this is studied by Swan et al. In the year very recently, 2024. Whereas the peculiar histopathological lesions will always look like this. Then the diagnosis of this particular disease is not a difficult task by the examination of the tissues or the lesions by external examination, and also the palpation is one of the better technique, and the surgical biopsies and the polymerase chain reactions PCRs have been developed to identify this virus, so the screening becomes very fast. Whereas the southern blot technique, dot blot technique, and also the reverse blot techniques are one of the important techniques that can diagnose the particular virus. Then the isothermal loop or mediated amplification, or it's also called as the LAMP, or the loop mediated amplification, or the amplification of this bovine papilloma DNA. So the genotype is very specific. Then premiers are used to identify and characterize the bovine papilloma virus 1, and findings were confirmed by sequencing and phylogenetic analysis. So this is the way the scientists have come to the conclusion that this is due to the bovine papilloma virus, which causes this warts especially. Then the laser micro detection for very precise excision of a particular cell also That's technology is already there, and the TEM, transmission electron microscopy, is one of the useful diagnostic tool for this particular disease diagnosis, as it is not going to harm the disease or cause fatality, and many people are not worried about the diagnosis and treatment of such disorders. And anytime the BPV is a self-limiting disorder, and if there is a uncomplicated case, automatically it get uh, resolved. Then the treatment, coming to the line of the treatment, and few of the words we need to understand how the virus is having, automatically it is getting resolved. Here you can see many times it is going to be resolved. So there is a spontaneous recovery rate what we have, although the spontaneous resolution rate of the wars is 65 to 78%. So this is the highest resolution rate of automatically it is going to be normal, but only one condition: the management of different types of the wards still continue to annoy both patients and also the dermatologist, because or else it's a self-limiting disorder. It's not going to cause much divorce, etc. But the main goal of treating is to eradicate the lesions, number one, while attempting to minimize the pain of the particular tissue where the infection is very high. So the choice of treatment will depend upon the location. Sometimes it is located on the head, sometimes it is located on the other tissues, and sometimes it's also located in different parts of the body. Wherever the loose skin is there, then the warts may be pedunculated also. Then it depends upon the size, number, and type of the words, as well as on the age of the animal. So this need to be considered while designing the therapeutic protocol for the treatment of the warts, especially in case of the large animals. Then the treatment of the warts depend upon two main therapeutic options. The first one is conventional destructive destruction of the that particular lesion. So the other line of the treatment is the chemical cautery or the chemotherapy, or sometimes physical intervention. The cryotherapy is also very effective, whereas the electrocauterization is also better compared to the other thing, and also the surgical excision. So sometimes if an entire animal is affected with the virus, it is the mismanagement by a farmer, then entire time the more and more body surfaces will be covered by such virus. Hence, the techniques like laser ablation, then sometimes the surgery may also require, depending upon the type of the condition it is. So here you can see that the second one, the line of treatment is, number one is the using the chemical agents, and also the conventional destruction of the particularly the wound. But at the same time, the immunotherapy, activation of the immune system, or the activity of this particular virus need to be supplied by us. So when it is brought to the notice of a veterinarian, most of the wards it have already grown too much at large, and later he experts in magic. But as this is a viral disease, we do not have much choices, just like the bacterial disease. Then so many agents are used for the immunotherapy, and the to list few of them. Then here you can see in case of human treatment, all these agents are used with differing type of the success rate. So whenever a human warts is there, if you go to the dermatologist, he will suggest multi-drug therapy. That may be the reason for this particular protocol also. So the topical agents are first preferred because the farmers do not have the patience to apply it to the area where it is highly affected. It is not like that, but the intranasal lesional agents can also be there. So some of the agents can be directly getting cured. Then they may require the surgical intervention by the qualified doctors. Then also the other factors like the BCG vaccine administration or RPD milk fever vaccine. Sometimes the environmental change, also the interferon alpha, vitamin B12, and zinc and copper need to be balanced very properly. Zinc and phosphorus need to be balanced very properly. And this type of the management system, most of the time, it will not allow the virus to enter into the body. That's one of the things once people need to be understood. Then apart from this one, zinc, for example, 10 milligram per kg per day, it has eliminated the zinc also. Then for customer, what we can suggest is the cutaneous type of the dermatological disorder need to be decided by the local veterinarian level, and he can administer the other drugs which have come nowadays. The market they are already being purchased, so such drugs can be used that will be beneficial. So here you can see that starting from BCG, MW vaccine, BCG vaccine, PPD is another thing. Then also candidial extract will be there, whereas the trichoiton Tilon and the deficiency of the vitamin B1, B12, B4, etc. are being discussed here. So apart from this one, you can also separate to see the name of the drug like cimetidine. It's a H2 receptor blocker. Whenever the animal is in lot of heat only or heat stress, then only it's going to affect, or else it will be not be absorbed into circulation. Also, that one need to understand. So here they have used the range of the drugs like starting from endotoxin. They have screened all the animals in the name of the what cure. Then no single treatment is completely effective in all animals. This one should remember. There is no single shot of a injection which can do care myself. So that's the only assurance or guarantee what we call. Now the thing is he has to get the pup on his bed and it used to undergo the sleep properly. So these are all some of the things need to be informed. The automatic recovery of these papilloma lesions may sometimes confuse for efficacy of the treatment, just like the homeopathy is the one, which is claimed to be effective, but no study has been conducted. Warts usually shrink and drop after a few months or with an opportunity or apparently naturally. So the animals may be having low type of the profile of virus, it is not possible to dissect many times. So the lesions of this will be the recovery has been to the basis of the alleged effectiveness or many type of. So any loss is a loss to the farmer. Then the folklore medicines, of course, many medicines are told, and we do not which is effective and which is not effective, etc. We as do not have the control in. So they tell that many variants of ray rub a dusty over the wound, then dry and load the particular packs, and also we can make it to reach wherever it is possible. So there are a lot of folklore therapies, etc. there, and the therapies are always depending upon the type and nature and many more type of the thing. And there is no single type of the treatment is there, and multiple line of the treatment need to be used for it. So none of the treatments are effective. Whereas the folklore, so many type of the things are there, rub and dusty dry, especially toad and warts, and they will disappear. Back up again, then stump and jam your hand and say, barley corn, engine mill charts, spunk water, swallow these warts. So all type of the superstitions, everything is there, unlike the other disease like. So before these remedies are scaffold, as they are the reminder that many wards resolve spontaneously regardless of the treatment lack of. So this method is not working now as it is one of the placebo type of the treatment. And the hypnotic or suggestive therapy was also there in the human beings, but these are legally largely case reports of small case series and no controls of the comparison, and we cannot trust this without any systematic trials or whatever it may be. That's also the another thing. So it is an untrusted method. What this especially the hypnotic treatment and many type of the treatments are not so dependable. Whereas the treatment of the common warts, especially this is from the human side, so the veterinarian should note down what are all the types of the warts, especially the number one thing is treatment for common wart. Here, the destruction of the treatment, that like by salicylic acid, cryotherapy, cantharidin, trichloroacetic acid, followed by surgery, phototherapy, laser therapy, and also retinoid therapy. So, apart from this one, antimitotic drugs are also used like the 5-fluorouracil, bleomycin, cidofovir, then podopilin toxin. Whereas the other line of the treatments are the local hyperthermia, duct tape, then garlic extract, sometimes the hypnosis, which is not working, then the sign catechins, glutaraldehyde, formaldehyde, then apart from this one, the immunotherapy, social immunotherapeutic, topical immunotherapeutic agents, and systematic immunotherapeutic agents are also there. Then intralesional immunotherapy is also another technique. So the treatment of warts is number one, the destruction type of the treatments. Means by any means we have to destroy the warts by extirpation or by some chemical like podopilin. So this podopilin is obtained from Podophyllum peltatum plant, and podopilin is a herbal or American or Indian that stops mitodes type of the divisions in the metaphase and causes cells to die. Whereas the podopylene and potassium iodide are smashed over 96% of the alcohol and homogenized. Then, then these to be applied topically once in 3 days during the 27 days. Then the podopylene magistral formula is another thing. This magistral formula are medicinal products prepared in pharmacy for an individual patient or animal in accordance with the prescription of a veterinary doctor. So here the application to be performed for all teeth warts once in 3 days during the 27-day program. So, 8 hours after applying the drug, teeth need to be washed with sterile water. Then, warts on the teeth will regress and dried out uh, on the day 27. So, that's how the podopylene works. It is requiring for about 27-day treatment. So, this is the plant, podopylene plant, and the extract is prepared. So the podopylene is usually administered as the magistral drug containing the active substance podopylene. So a this is applied every day on the affected teeth, then containing the active substances, that's the podopylene. Right front back teeth on day 27, you can see that most of the tissue is healed. Whereas in this particular figure, you can see that the administration of the particular drug, then left black teeth day 1, whereas the administration of the particular drug for 27 days, it almost healed. And this is studied by the Kale et al. In the year 2012. Then podopilotoxin is also a commercial product now in a different trade name. So if it is administered as 0.5% solution for the vehicle at home twice daily for 3 consecutive days of each week for 4 weeks until it requires 4 weeks for 95% reduction. 4 weeks are almost its coincidences with that of the natural recovery process. So this solution appears highly effective podopilotoxin for the short-term treatment of symptoms, but does not provide a long-term cure. Like if the size is very high, then this will not work at all. Then the papilloma autologous vaccine is one of the most popular thing. Then how to prepare it? 5 gram papilloma tissue smashed and about 1/10 phosphate buffer solution is prepared. Then drained into the sterilized beaker covered by the muslin cloth. Then supernatant is centrifuged at 4 degrees Celsius at 3000 rpm for 30 minutes. Then 10 ml supernatant, especially 0.04 ml of the 40% formaldehyde. Just you see zero point 0.0 ml to the 10 ml. It has to be added. Then incubated in stove for 37 degree Celsius for the 24 hours with tube inlet open always. Then fluid is filtered with 0.22 micrometer diameter injector filters. So the 5 ml of this solution subcutaneously to be administered and revaccinate at 7 days for 4 weeks. So this is a very crude form of the vaccine that can be administered to the animal. So the many of the veterinarians are using this thing, and it is giving some satisfactory type of the recovery rate. Then it takes about 2 months for the complete recovery. So this almost coincidences with that of the natural recovery process. But if the size of the warts is very high, then it will be useful. Then autohemotherapy may serve as one of the useful adjunct to the autogenous vaccine. Sometimes taking the blood of the animal and injecting it to the same animal. And success of the vaccination depend upon the individual immunity and its response to the vaccination also. So here also you can take few of the about 5 gram, then put it in a bowl, then put the PBS, then zero point 0.4 ml of the formaldehyde solution to be put to the 10 ml, then automatically it need to be crushed properly. Then the next day administration of the autogenous vaccine will always helpful for the complete recovery most of the time. So this is also reported by Kale et al. 2018. And here you can see that before treatment this was the adder, and later it has been recovered to the extent of 99% autogenous vaccine only. So the autohemotherapy is simply administration of about 20 ml of the intravenous blood, then it need to be injected simultaneously in the lateral neck region of the taking all sterile precautions. So repeat the treatment once in a week for 4 weeks continuously. This will give almost a good percent of the recovery also. Whereas the teats need to be always washed with proper antiseptic, then apply any one of the ointment which is containing maybe a povidone, chlorhexidine, and any of the antiseptic ointments. So here we can see that the curve is affected to the such greatest effect, and this type of the lesions always do require the surgical extirpation followed by the chemotherapy or the treatment with some of the drugs. Then here you can see that the pedunculated type of the warts also present on the mouth of the animal, and sometimes brisket region, and also sometimes the scapula or the loin region of the animal. And other treatments, recently the ivermectin in the year 2028 is the drug used in the treatment of endo and ectoparasiticides, is also used as a repurposed drug at the dose rate of zero point 0.3 milligram per kg subcutaneously. Even with single shot, it is said that about 70 to 86.67% recovery in double shots. Whereas if we go for 3 shots, then there is 100% recovery. So the ivermectin at the dose rate of zero point 0.2 milligram per kg body weight twice with 2 weeks intervals subcutaneously has the larger sized and older nodules. They are removed by manual excision. So it is not going to be cured by simple administration of the ivermectin also. So it may take about 2 months as per Abdi Fuba Visa in the year 2018. Here you can see that ivermectin effect on bovine warts. So these warts has occurred in the leg region. Then after administration of the ivermectin subcutaneously, it has almost all cured. Then, no recovery observed in the group during the study period, especially in case of the control animals. Then, ivermectin in the cattle group. Then, pre-treatment and post-treatment with ivermectin, especially in case of the affected animal, could recover to the extent of 88%, and in the other group it is 77%. So showed complete recovery within 3 months of the observation period. So two dose is better than that of the single dose. That is a research conducted in 2007. And lithium antimony thiamalate is another drug, but of course it is one of the painful drug. It need to be administered as 15 ml of the drug deep intramuscular, and a total of 5 doses on alternative days are required. And the injection is very painful and require a caution in terms of the physiotherapy at the site of the administration. And some pregnant animal may abort also, and complete clinical cure in total healing regression or slumping up of the warts will take place only after 40 to 90 days of the post therapy, and not to be used in case of the pregnant animal and also the lactating animal. Other than this thing, so many other remedial measures are also there, like the magnesium chloride administration, intravenous infusion, cryotherapy with liquid nitrogen, and the other therapies like the salicylic acid treatment. And it's a very good keratolytic agent, especially in case of human warts. And keratolytics that lyses the epidermis, available as 17% salicylic acid ointment in a base flexible of colloidine, or as 40% salicylic acid. And not often it is not painful, whereas many preparations are there with 10 to 60% also. So we can prepare the solution of the salicylic acid as a keratolytic agent, and it's a line of treatment for the warts. And salicylic acid produces discoamation by solubilizing the intracellular cement that binds scales in the stratum corneum. And it takes about 30 to 40 days to cure the warts completely. Then the data pulled from six placebo controlled trials demonstrated that the cure rate of 75% in the salicylic acid treatment compared with that of the placebo arm also, because it's a self-limiting disease. So when compared to the placebo, it was a better line of the treatment. And this indicates that even with the placebo therapy, the lesions will be cured to the extent of 48%, and also diluted homeo preparations may do this similar job. This is not my statement. Sterling et al. In the year 2001, they have done this particular job. Even without any treatment, 48% of the recovery is there. And if the treatment, then the recovery chances are more and more. So there are many type of the things like the cantharidin. So it's a topical keratolytic agent and a vesicant that includes acantholysis and intradermal skin blistering within 24 to 48 hours of application via degradation of the desmosomal attachments, leading to the exfoliation of the virus containing tissues. So, many times the cantharidin plus podopiliotoxin, then the salicylic acid is very effective against the human warts, especially. So, the cure rates have been reported to be as high as 80%. So here all the three drugs are mixed, like cantharidin, podopilatoxin, then salicylic acid. So this there is no pain from the application of cantharidin if it is in the combination form. However, there is a clinical data or no good controlled placebo controlled studies are there, but preparations are always available as the salicylic acid, podopilatoxin, then the this especially the cantharidin also. So here, after application of this preparation, many times the pods, warts have been disappeared. So the active compound of this methyl salicylate is also effective the warts and breaks down the warts into structure and also renew the skin also, means methyl salicylate. And trichloroacetic acid or TCA and causes superficial necrosis by the chemical dehydration of the affected tissues. So sometimes It is available as 80, 90, and 100% solutions, and we can find the different rates of the recovery. So, levomethil, a imidazole derivative drug, act as cholinergic agonists, and in addition to the enthalmatic impact of the levomethil, the drug also has stimulating impact on immune response. Hence, it may be effective, like it may stimulate the T lymphocytes, but it should be used in small doses, like just 2 to 3 milligram per kg subcutaneously at frequent intervals to stimulate the immune system. And levomethil at the dose rate of 2.5 milligram per kg IM on the days odd days, all 1, 3, 7, 9, and day 16 by oral and parenteral route combination obtain 82 to 80%. Parenteral more recovery is seen when compared to the control group as an experimental study. Then sometimes this is also another thing. This tarantula is a species which is belonging to the spider species, and the extract of this Tarantula cubensis is applied as normal therapeutic doses and was more effective in the treatment group than that of the levomethil. So the animals need to be injected twice with the subcutaneous 10 ml dose of the Tarantula cubensis extract. So the exact mechanism how it works is not known, but it is said to have some curative rate. Then antimitotic drugs like the 5-fluorouracil is also a choice of the drug, and it's used with very high efficacy for the treatment of human wounds. But the average time to cure is about 9 weeks, and the chance of reoccurrence is alone is 5-fluorouracil. So then antimitotic drugs like the bleomycin is an antimitotic drug that acts by formation of free radicals from binding the guanosine cytosine rich protein DNA that causes the DNA single strand breaks. So, bleomycin is typically administered as subdermal injection by pricking the lesions with a bifurcated needle. Means bleomycin is a physical agent applied, physician applied treatment with a maximal dose of 4 injections in different intervals. Then the cidofovir and cytosine is also another drug, and all herpes virus and papilloma virus are highly susceptible to this particular antimitotic drug, that is the cidofovir cytosine. Here you can see that it is available as multiple uh, preparations like Vistidine, cidofovir, etc. Then this is effective in case of the human beings. Of course, the cost is very high. Then antigen like the BCG, Bacillus, Carmate, and Virin, and it's one of the agents used in immunotherapy of the warts. So its precise mechanism of action is not known, but it is speculated that it upregulates the Th1 type of the cytokine response, IFN alpha, interleukin 2, and 12, 18, interferon gamma, tumor necrosis alpha, as well as induce a non-specific immunomodulatory actor or inflammatory response against the virus. And most of the researchers used intralesional injections of the BCG vaccine to treat a recalcitrant virus and a new, and this is a new type of treatment, and few of them the intradermal route also followed with no systematic veterinary trials are there, but some claim that this is effective. And if anybody want to do some trial, this can also be done, especially topical bacillus camate virin. Then retinoids are also used like triretinoid cream then it's a immunomodulator, and these retinoids can downregulate the herpes virus transcriptions in an affected cells, as well as then the cream which is containing the 85% of the retinoids. They are effective in case of the children birds. So, lot of research is also going on the herpes virus or the bovine papillomavirus related cervical cancer also in this particular uh, retinoids. Then zinc sulfate is one of the better line of the treatment, acts as a immune modulator. So many times the zinc containing preparations like the tablets or the mineral mixtures which do contain zinc may boost up the immune response. At the same time, the skin healers may also be this there. And dietary zinc has been performed very well. And the 10 milligram per kg body weight is always required for the supplementation, the zinc supplementation to be administered when the animal is in the recovery stage. So, complete clearance was observed in a study to the extent of 87%, and the compared to the placebo controlled groups. So intranasal injection of intralesional injection of the interferon alpha, it kills and stimulates in 62% of the patients. The main purpose of telling this thing is anything which can be used to the extent of 85 to 90%. So other treatments like garlic extract is also there. Then sometimes the one placebo control trial, the application of chloroform extract of chloride was reported to result in the complete resolution of the cutaneous warts with no reoccurrence even after 3 to 4 months. Garlic. Then usually, whenever such huge mass of the pedunculated or the cauliflower-like growths are there, then none of the treatment may be effective. At that time, surgical extirpation or surgical excision is one of the better line of the treatment, and the animal will be anesthetized and under a mild sedation or sometimes under the local anesthesia also the lesions need to be extirpated, and later one can administer ivermectin, then streptomycin, flunixin, and also the multivitamin injections, and the Usman and Vadabava in the 2024 they have informed that this treatment is very very effective. Whereas the cyanocatagens also another category which also contain the active principles, especially of the cyanocatagens at the rate of 15% ointment. Then duct tape is another one where in which warts completely resolve to the extent of 85% of the duct tape arm in case of human beings, but this is not tried in case of the large animals, but tried only in few days with less success because the automutilation they are going to remove it. Hot water is also another type of the treatment, and it has observed that it has dramatically improved certain cases of the cutaneous warts of hands and feet. So this this option can also be used. Of course, one of the old line of the treatment, but it's effective. Then glutaraldehyde is a virucidal and available as 10% water miscible gel or alcohol solution. So the application of glutaraldehyde is typically applied twice a day and can stain the skin brown as well as cause contact sensitivity, and hence the treatment has been reported to be as effective with that of the salicylic acid with cure rate of 70%. So no randomized controlled trials for glutaraldehyde have been published, but it is claimed that this is effective. Then apart from this one, the formic acid is also another acid with the bites of honey, hymenopteran insects, including the bees and ants. So, especially first isolated from the red ants. So, this can also be used for the treatment, and about 85% of the formic acid needle puncture technique resulted in 92% complete chance or the clearance rate of the wart tissue when compared to the placebo group. So the salicylic acid, then trichloroacetic acid, bichloroacetic acid, then formic acid. These are equally effective and also the trichloroacetic acid. So a combination of all these things may also increase the efficacy rate of the treatment. Apart from this one, so many type of the veterinary or pharmacology treatments are there. Fig tree like Ficus carica, latex is a local treatment, and the fig tree latex need to be collected freshly. Then it need to be collected from the particular plant, and it can be stored at 30 degrees centigrade as a short period. So here also we can see some cure rate. Then apart from this one, formaldehyde, a virucidal agent and has the strong disinfectant properties and exerts in effects by causing damage to the upper layers of the epidermal cells that do contain the virus and the virus destroyed by the particular solution. And most common side effects of the formalin include redness, irritation, then dryness of the skin. That we need to explain it to the owner, and if it's possible, better to avoid it also. Then 0.7% gel or 3% solutions are available, and the cure rates are about 62 to 67% at the rate of the daily application, but 2 months are required. And no difference between the treatment and placebo, that was also one observed. So, hence, the formaldehyde treatment is also again a question mark. So the chlorhexidine is one of the another drug or which is the content of the most antiseptic properties. Then it is very effective against the teeth wart disinfection. So before and after it has reduced to the extent of the 25 to 50% at the maximum care. Like this type of the particular tissues are always available. Then, of course, they have reduced in mass, size, and the pathogenicity, means irritations, etc. Then, nowadays, these have been recorded as the important lesion of the virus. So, sometimes this is also going to be confused with that of the bovine pox. So, one should not confuse, and this is a bovine papillomatosis virus infection. So like this, many times we can get confused that of the cowpox, but it is little hard and sometimes it may contain the pus also. So hence the chlorhexidine solution, if if it is in the early stage without any other drug intervention, it is going to cure after 1 month and half month also. The treatment with chlorhexidine need to be validated properly. So this is one of the thing that makes the animal little unhealthy, and also many type of the herbs like allium, satigum, musa, then acalypha, gingiber. All these need to be claimed to be very good, especially in case of external application like 80.6%. as recovery rate of 28.3%. Then this is a mixture of euphorbia, then the curcuma longa, then the banana or musa, allium sativum. All these need to be mixed properly, then applied externally. Thuja orientalis, a crude plant extract, of course, we have studied it, need to be prepared every day fresh and need to be applied on the wards for minimum 30 days, or else we will not get any of the result if we left the treatment in between or negligence, etc. So, every day it has to be treated, but it is going to treat 82% of the animals affected without any relapse even after 2 months. And this Tuja orientalis should be crude plant extract, proved better than that of the homeopathic remedies. But homeopathic remedies with more and more dilution uh, do not have any more efficacy than that of the placebo controlled group. That's the study says. So the Tuja extract, fresh extract may always be useful. Then homeopathy treatment, so many claims are there. Tuja drops 200 C once ml twice daily for 7 days, followed by 1 ml twice day for next 23 days. And it is need to be applied over a watts of 30 days twice. So it is claimed that this gives better result up to the cure rate of 75%. But once again, as the homeopathy is a very controversial subject, especially about the dilution factor. Hence, the repeatability of the same is under question, and we need to test that particular compound. And apart from this one, Thuja major tincture, which is containing the Thuja orientalis, to the extent of 78%, and many times the warts reoccur also. Then coming to the last thing, that's the conclusion. The bovine papillomatosis is a self-limiting viral disease which cattle usually resolved by the day of 60 to 75 days, and it is complicated with benign tumors, maggots, bacterial infection, deficiency diseases, etc. Hence, no single line of the remedy has been found to be efficacious. Always, it's a multi-drug therapy, and apart from this one, the acyclovir is also another drug that is used. So the therapy success rate depends on the stage of the papillomatosis, secondary complications, immunity factors, and it is transmissible from one animal to the another animal and hence needs proper care and management. And apart from this one need to prevent the animal affected to have the contact with the another animal. Hence, the management aspect is also very important. And these are all the selected references starting from the 2024. Then also start many of the important references which are used for the preparation of this particular presentation. And thank you very much for the patient hearing, and thanks a lot for the thing. And this is, as a conclusion, the particularly the warts is a self-limiting disease with the success, this self-limiting rate to the extent of 65 to 70%. Hence, one need to be careful about the automatic recovery or the self-limiting nature. Only if complicated, then it may require the treatment, especially if it is infected with bacteria, etc. Then it may require the a proper treatment, or else it's a self-limiting disorder, and hence many times the placebo may also get it cured. Hence, the multi-drug therapy may be required as and when required, and the veterinarian is the one who is going to decide which type of the treatment is required to the animal for the quicker and faster recovery rate with very low adverse effect. Thanks a lot and have a great day. Bye for now. I will come up with some other topic in future. Thanks a lot. Namaskar.